everyone, this is Josh from the Hayes Drive, and I'm joined today by State Representative Erin Zwiener from District 45. Erin, Representative Zwiener, thank you very much for joining us today.
Thank you so much for having me, Josh.
Cool. Well, let's just jump right in. There's a lot going on this year. Obviously, it's a chaotic year, and what the Hayes Drive has started out as a discussion place for COVID-19, where people can get information. So we thought it would be a good idea to bring in our local representative to talk about that. So to start off with, can you tell us a little bit about your office's activities and efforts in response to COVID that you've been doing to try to help get information, help collect data?
Yeah, it's an interesting time to be a legislator because we aren't in session right now. So, I, at this moment in time, cannot make laws. Our normal regular sessions are every odd-numbered year from January to May. And I am trying not to sneeze, Josh. So if I look and make a funny face, that is why.
It's okay. We're more than 6 feet apart. It's okay.
All right. Yeah, different towns even.
Yeah.
So I am. So we can't make laws right now, and that's actually something that's been incredibly frustrating. Is that we can't execute a lot of our normal oversight, and that's been exacerbated because the governor made the decision to close the Texas Capitol. Now that was done for the safety of our staffs and for the public, and for the folks who work there. And quite frankly, we've pretty consistently had positive cases in the Capitol this entire time, particularly among the Department of Public Safety troopers. So we haven't been able to have committee hearings. Normally we'd have interim hearings where we get to talk to agency heads and ask questions. We don't get to do that in the same way. One of my colleagues described it as it feels like we're trying to have our oversight via letter, and it's not the most effective way. It's not nearly as effective as a hearing where you can have a direct conversation with somebody running an agency. So the person who has the power to bring us back right now, just to be clear, is the governor. He could bring us back for a special session. He's chosen not to do that. There's a lot of factors in that decision, but I will say it is quite frustrating to not feel like we can perform our full responsibilities. And unfortunately, some of the ways our House rules are written don't allow us to do some of that traditional work virtually. And to change our rules, we would have to have a session. So we're sort of caught in this catch-22. We found some creative ways around it to sort of have members of committees come together, group questions together, and then the chair of the committee can call the agency heads and the folks they want to testify and have them read their responses. But they have to be submitted in advance. It's not of the moment. Anyway, I'm getting way too in the weeds of our attempts to govern right now. But suffice it to say, it's a hard moment to be a legislator because the power right now really is in the hands of our executive offices. As soon as you declare an emergency, the people who get a lot more powerful are the governor, our county judges, and our mayors. They are the folks who have emergency powers vested in them. And when they do a disaster declaration, that triggers some pretty big responses and some pretty big abilities. And those are important. They're there for a reason, but it's unusual to stay in a disaster declaration situation this long.
Oh, go ahead.
Yeah.
Sorry.
Well, it's just brought up a lot of governance challenges that I'm certain we're going to talk about next legislative session. At the county level, I'd have to look up the exact number of days, but there's a certain time period where a judge can declare a disaster, and then the county commissioner's court has to come and allow him to extend it.
Wow.
There's not that equivalent at the state level. The governor can keep just issuing new disaster declarations. So I think some of us are talking about whether or not we need a trigger that if we are in disaster declaration for X number of days, the legislature automatically gets called back or something like that, so that we can.
Especially in today's time with just so much chaos going on, and with schools opening up soon, there's just seems like you guys are handcuffed and you're communicating via grapevine. Where it's just kind of like, because so how does that go into it when the governor makes a decision? So you don't really have any say whatsoever, except for beyond just like, hey, here's what I would like. Let me send you a letter and I hope he reads it.
Yeah, we can send letters, but quite frankly, what's not effective is the letters. What's effective is like a good tweet that gets people's attention and gets picked up by media and creates some noise. And it's incredibly frustrating for me. I was not Personally, I was not a big Twitter user before the pandemic, but then it pretty clearly became a very useful tool during it, and I got more invested and more engaged. But I'll give you an example. Is there was something mentioned on one of our legislative briefing calls. So the agencies that still routinely brief legislators are Texas Department of State Health Services, Texas Department of Emergency Management, and Health and Human Services Commission. They jointly brief legislators every week. Those used to be two-way calls where legislators could ask questions back to the agencies, but because some of our, I'll say, fringe members of the legislature who believe that COVID is a conspiracy are suing the Department of State Health Services and the governor and several other folks. And because of those legal issues, our calls can no longer be two-way. We have to submit questions in advance. That just changed this week, and it's quite frustrating. But it also means we hear a lot fewer conspiracy theories on the call. So you win some, you lose some. And then Texas Workforce Commission has also been routinely briefing legislators and their staffs as well, because our biggest change in our workload when COVID started was just this avalanche of folks needing help filing for unemployment. And last session, we allocated dollars for Texas Workforce Commission to update their systems which were designed in the 90s. I did say 90s. And quite frankly, those dollars came too late. Texas Workforce Commission was about to sign a contract with someone to get the new system built right when COVID hit. And so all this incredible growth in unemployment claims that has no precedent had to go through this ancient system that didn't work very well. And there were issues like, the system would automatically send people emails saying, hey, thank you for submitting your claim. We need XYZ information. Please call within this number of days to process it or to give us this info. And people couldn't get through to call the system, or couldn't get through on the phones. And Texas Workforce Commission said, well, of course that 5-day deadline is not required right now. We understand, all deadlines are lifted. We're figuring it out. And we were like, well, could you stop sending them the email? And they're like, we're really afraid to touch that piece of code and what might happen to the rest of the system. I mean, it was clunky, and there'd been decades of patches put into it. And it was really hard for them to work with. It was incredibly hard for them to work with. That said, I do think Texas did a pretty good job getting their unemployment benefits out early. We added, the federal government through the CARES Act added benefits for a lot of folks through Texas Workforce Commission. And that was the extra $600 a week that folks could get if they qualified for any amount of unemployment. Now that has expired as of the end of July. Congress is still arguing about whether or not they're going to extend some of that. But they also created the ability for contract workers and gig workers to get unemployment, which is incredibly important because so many people, particularly millennials and Gen Z, entered into this gig economy where they have jobs, but they might not be W-2 employees, even if they probably should be. Abusing contracting in Texas is definitely a thing. There are a lot of people who should be classified as employees who are classified as contractors. And anyone who is classified as a contractor, anyone who ran their own business, which, for example, could be like someone who works at a hair salon. They often are considered independent businesses. My sister had a job shortly after she graduated college where she was essentially a personal assistant, but she was a contractor and couldn't collect unemployment. So the federal government added those benefits, and Texas got those on the ground and available to people almost as fast as any of the other states. So I was really impressed watching that and seeing some of my colleagues in other states talk about those benefits coming on, over a month after they did here in Texas. So I'm grateful that we've been able to do that. But I got off on a long tangent about unemployment. Oh, but actually, let me say very quickly, you are still eligible to apply for unemployment if you are a contract worker who has lost a substantial portion of your income. And if you need any help, please call my office. And here's the other thing: if you can backdate your claim back to when you first became unemployed. So if you became unemployed in March and you have not yet applied for unemployment, you can still apply and you can get benefits back to the first day you were eligible. So if you, and that includes that extra $600 a week that expired at the end of July. I don't know
Wow.
exactly how long that's going to last with Texas Workforce Commission. Still trying to, they don't have a firm answer on that, on when the federal dollars are going to disappear. But you should know that those dollars are there for a reason. I don't want anybody to feel guilty about using it. So if you've become unemployed, or if you're self-employed and you've seen a dramatic drop in income, please, please, please apply for unemployment. The backlogs in the Texas Workforce Commission system are mostly worked out. And if you need any help, contact my office, district45.zwiener@house.texas.gov or 512-463-0647. We will help you through that process. It is what my staff spend the most time doing right now, is just helping people get some dollars in their pockets so you can stay in your homes, feed your family, etc. And again, I really want to emphasize that people should not feel guilty about collecting these dollars. I know a lot of folks have this idea that, you know, they don't need help, they can be strong, but it is good for our economy for you to have some cash in your pocket. It provides more stability for the rest of the system. If you have to move or downsize, or if you have to buy less of something or cancel services, that has ripple effects in the entire economy, and creating a sense of stability is part of why those dollars are there. So it's not just you helping yourself, it's you doing your part to keep the whole economy functional and intact, so that once we're all the way through COVID, we can recover quickly and strongly. That was a long sidetrack about unemployment.
But I'm so glad you did, though, because I had no idea about the backlog and the independent workers. That is extraordinary information to have out there, and that's just not being told unless you jump through hoops, or you're fortunate enough to have a representative say that. But that segues into this, is that the frustrating thing for me is the inconsistency or lack of information coming through. So you talk about archaic 90s machines running things. We also are running into all this misinformation or inconsistent information with testing and logging the information. The Texas just changed how they log the death certificates and the death dates. And with KVU Defenders just did a report that said no state agency has any plans to log or track coronavirus in schools, with schools opening up. And that just boggled my mind, why we wouldn't have some kind of area just to log it in. So
I wish my mind was still boggled by that. I wish my mind was still boggled by that. The experience I keep feeling like I have on these legislative briefing calls is like, I ask a question that I think is pretty obvious and that there'll be a pretty simple answer to, and I stump everybody. And I'm like, well, what happened? Why am I stumping you? Yeah. I'm not sure why. And you'll notice I mentioned the agencies that routinely brief us. I did not mention Texas Education Agency. They have been harder to get information from. Whoa. I remember one call we had with Commissioner Morath early where we could actually ask questions back. The last time we had a call with Commissioner Morath, we didn't know he was going to be on the call. It was set up as a governor call. And then he was there and talking about the reopening plans, and there wasn't any, and it was a call where you had to submit questions in advance. So there wasn't any ability to kind of go back and forth there. I think TEA has been a little more challenging to get information from.
And why?
So, I wish I had a good answer for you, but what the pattern I keep seeing is people prioritizing hope over substance. And I'm a hopeful human. I believe in the power of hope, but I also believe in the power of preparation. And what happened here in Texas is, COVID hit Washington and then New York City and California very hard. And Texas went, oh, wow, we might be next.
I don't know if a lot of people said that, though. That's the problem. Well, a lot of people said, I think we're not New York.
Yeah. I mean, that happened too. I know. I mean, we didn't go as strong. We didn't. But so we took some measures. The governor did do a version of a stay-at-home order, but you talk about confusion. He did not call it a stay-at-home order. In fact, I was going to say that was maybe one of my more effective tweets, was ranting about that. And then 2 days later, the governor called it a stay-at-home order. And I'm like, okay, are things trickling through the other? I mean, it's very frustrating because you never know what's actually you, but you keep pushing and hoping that other people are amplifying the same message and that you cut through the noise. But so the governor did a version of a stay-at-home order. Things didn't get very bad in Texas. we didn't get hit early, and that was luck. I mean, there are some intrinsic factors for why New York City and Washington and California got hit early. And I think we can definitely talk about some mistakes New York made early on that made it happen faster and worse there. I mean, Washington and California had almost no opportunity to be successful. New York had some, and they missed some of it. They're pretty on board now, but they were too late. So here in Texas, we took some measures, and then we didn't get hit. We don't have the same amount of international travel that New York City does, and we got lucky. We kept our cases mostly under control. A lot of people stayed home. We slowed the spread. We did. The problem is, about a month after we did the stay-at-home order, we started to reopen. And we started to reopen without clear messaging or clear practices to keep us safe, or the clear infrastructure as well. What we needed to reopen safely is we needed testing. We needed adequate testing, and we just never consistently hit the governor's goals for testing. I do want to say testing availability is somewhat of a statewide issue, but it's also a federal issue, and we were fighting every other state in the nation for capacity. And my understanding is that there'd be a lot of frustration that because we didn't get hit as hard, we had a harder time getting resources. Mm-hmm. We needed to be through our personal protective equipment shortage. That's something that I think a lot of folks have forgotten about. I keep hearing folks say, goodness, why did we shut down elective surgeries? Like, we never got hit hard at that point. We didn't just shut down elective surgeries because of concerns about bed capacity. That was one factor. But honestly, the more urgent concern was personal protective equipment for our medical providers. We had a global shortage of enough masks and gowns and gloves. And our hospitals needed to conserve every little bit. I know here in Hays County, our emergency services folks were like calling vet offices to get gloves. I reached out to Lehigh Cement. Lehigh Cement donated a few 195 masks to the county to help.
Oh, wow.
After we reached out to them. But I mean, it was like that type of just calling everyone who might have that type of equipment and begging for it was the dynamic. And then things started to loosen up a little bit. And I should say, part of the reason we had this worldwide PPE shortage is because the areas in China that got hit hard and hit first were some of the same areas that manufactured this equipment. So we had demand go up, we had supply evaporate. We haven't done a very good job in the United States maintaining the production of those materials. Our president declined to use the emergency, I'm going to get the name wrong now, but there's an act that allows him to start take over factories and say, this is what you're going to make.
Yeah, World War II, to manufacture military weapons and bullets. And
I mean, obviously something that should be used in critical circumstances, but we were there. Yeah. So that was part of why, so we needed the PPE. The PPE is a lot better. It's not perfect, but it's a lot better. The testing still oscillates a lot. There's been more and more issues of shortages of the reagents. The reagents are the chemicals that the various testing structures need to use to react and process the sample. And then we had to have contact tracing. And we still don't have good contact tracing in Texas. And contact tracing, has a couple main steps. I'm going so far into the weeds, Josh. Cut me off if I'm doing something not interesting.
well, no, I agree with you. It seemed like there was too much of, we were just trying to react to what was coming at us, and we weren't being proactive in preparation.
Right.
That saying, hope for the worst. Prepare for the worst, hope for the best. Right. There was none of that.
Instead, we went, it's going to be hot over the summer and heat kills the virus, and we're good.
In March, we should have been planning for plan A, B, C for reopening schools. What do we do if the numbers are here? What do we do if numbers are here? Should we get open spaces so we can have teachers teach from warehouses? How can we utilize our space and get people prepared? And that comes with federal as well. With CARES Act or a new kind of act, they could have said, hey, let's make sure parents who need schools so they can go to work have financial stability so that they can handle it. That just wasn't there. It was just kind of like, you figure it out. And that's kind of how what it seems like it's been in Texas as well, where the representatives are kind of.
Yeah, and I think what happened is we saw this little bit of a plateauing, and like we saw a little bit. Well, we rose in March. We kind of saw this gentle plateau in April. Saw a little bit of a decline in May, not a huge decline, but we saw a little bit of a decline in May, and we got complacent.
And we opened up, and we
and
said
then
it's all good.
Mid-June, it started to hit. I mean, it was, I think it was like June 12th or 13th when our case counts in Hays went through the roof.
San Marcos just exploded.
Yeah, I mean, it was almost overnight. We went from, an average of, I want to say it was like 14, 15 cases a day.
To 140, 130.
Yeah, to an average of like high 90s in a week. And I'm looking, a lot of times with this data, we try to look at 7-day rolling averages. And the reason we do that is to just sort of normalize any bumps, just because test results come back different days of the week at different rates. But we saw this, it was a 7-fold jump in positive cases in Hays County in a week. And we became a national hotspot. And there were issues all over the rest of Texas too. I remember calling up the chief of Texas Department of Emergency Management, and he was like, well, we're seeing case spikes in areas with prisons and jails and nursing homes. And I'm like, it's not our nursing homes. It's not our prison. I'm going to go call the sheriff. It's not the jail. Like, this is in our community. Or meatpacking plants were the other really common one. And I want to say that, like, cases in all of those spaces matter too. Those are people. Those are Texans. They are people we care about. But it is very different to manage an outbreak that's confined to a single facility than it is something that's distributed throughout the community. Yeah. And when something's distributed throughout the community, you can be almost certain that it is reflective of a large number of cases that we're not catching. Whereas in a facility, you have a shot at catching most of the cases through testing.
And that comes back to the testing now. It kind of, when we hit the spike, it went from these mobile sites where you could get it for free and you could get it for really almost any symptom, you could get a test. And then all of a sudden it was, nope, we're not going to test everybody because we need to limit it. So we weren't getting
that was because of that shortage on reagents I mentioned. And then the other big limiting factor is the number of physical machines that process the tests. It takes, I forget how long, but it takes time for one of those samples to sit in a machine, and they can only do so many at a time.
Well,
and our machines have been running at capacity nonstop since this started. So if you don't have enough machines, if you don't have enough reagent, you can have a major issue there.
Yeah, because our numbers are going down in Hays, but so is our testing. And while the positivity rate is going up because the people that are getting tests are more likely people that have it, but we're missing those asymptomatic. But then it goes into, so then we start going, oh, the numbers are down, we're great. So we start paying attention to the hospitalization numbers, which brings up an issue as well that you were quoted in the Austin American-Statesman.
Yeah, so let me say,
No, go ahead.
Oh, well, go ahead, Josh. Well, let me... I recommend that folks follow either the statewide hospitalization numbers or the regional hospitalization numbers, which Austin actually puts out. They put out numbers that include Hays County. And those numbers are looking at the number of people in the hospitals. They are not trying to track where those people are residents of, because quite frankly, that's pretty complicated and hard. And we are seeing those numbers start to improve. I should have that ahead of me, but we went from, pushing 90 to 100 new hospitalizations a day, and now we're like back down around 60.
Yeah, because I think a couple of weeks ago we were at almost 8,000 or 9,000 in the hospitals in Texas, and it's lowering in the 7,000. So we are going down.
It is dropping. It is absolutely dropping. And, it was confusing because we had a change in how data was collected during that period. The federal government made some changes, and I believe asked the data to go directly, I'm going to get the agency swap wrong. But it changed which agency was collecting the data, and it changed some of the vectors they were trying to collect data on. Made it a lot more complicated for hospitals. We had an issue where some of the smaller hospitals really had trouble complying. So for a few days, we only had it was either 84 or 86% of hospitals complying and actually getting the data in because they were struggling with the new system. But even with that, well, now we're at 99% compliance with the hospitals submitting their data again. So we can see that downward trend in hospitalizations is real. And that's really critical because hospitalizations are not affected by test availability.
Yeah.
They are a number independent of that. So if we see those trending downwards, it's a good sign.
Yes.
And I'm going to quote DSHS Commissioner John Hellerstedt and say the reason those numbers are going down is because people are wearing masks and social distancing and washing their hands. And as long as we continue to do that, we have a shot at keeping the virus under control. And the moment we stop, we will start to see cases rise. So I wanted to ask everyone here, please don't get complacent about this. We are going to need to be wearing masks when we are with folks who are not from our own household until there is a very effective treatment or until there is a vaccine. That is where we are at. That needs to be our norm for the next however long it takes.
And it's frustrating for me as a person just seeing how that basic concept is not just everybody should know that. It just makes sense. I wouldn't sneeze in your face in normal. I would cover my face. I would turn away. I would say, excuse me. And so why would you not take that extra step? And so, I ran into it.
This comes to some of the confusion you talked about around messaging. And, and I want to say there was earnest public health expert uncertainty about how effective masks were at the beginning of this. And I think the other thing that got really confusing is we at the beginning of this crisis had to ask folks not to hoard masks because we really needed them for medical providers.
Yeah.
We really needed everybody else just to stay home and let the medical providers have all the masks. And we were trying to figure out how effective masks were. So there's a couple different types of spread of viruses, but the two that people get confused with are droplet and airborne. COVID-19 most commonly spreads via droplet transmission, which is the same way flu spreads. And that means that when you talk, when you sing, when you sneeze, little droplets come out of your mouth. There's virus in them. They end up in somebody's eye, in their nose, in their mouth, and that person gets sick. There's also airborne transmission. Measles most commonly spreads airborne. And y'all may have heard, like, measles is so contagious that if somebody's been in the room with measles, you can't go in that room for like couple hours until the virus settles, which is very different. Now, COVID-19 can become airborne under certain circumstances, basically where the droplets get so small that it's effectively airborne and they linger in the air for a long time, but that's not the most common spread type of transmission. So masks don't work super well to prevent airborne spread, but they work really well to prevent droplet spread. And so the mask catches the little droplets, whichever way they're going, keeps them from coming into your body. And at the beginning of us starting to recommend that everybody wear masks, the public health evidence was that mask wearing helped protect the people around you if you had COVID and didn't know it. More and more as the research has come back, it's also that wearing a mask protects you. And one of the reasons for this is how sick people get with COVID is not just based on their risk factors. It's also based on their level of initial exposure, how much virus load they were exposed to at the beginning. So people who get a whole bunch of virus at once are going to be more likely to get very, very sick. People who get just a little bit of virus are more likely to be able to fight it off quickly and, be someone who has symptoms more in line with the flu than with, what COVID has become famous for. So wearing your mask protects you and everybody else.
Yeah, and it's the frustrating and it's the beauty of science as well. As so many people were like, well, so-and-so said at the beginning that masks didn't work, don't wear masks. But that's the nature of science. You have a hypothesis, you think this is it, you get new information, and you evolve your decision and your information. So at the beginning, they were
science
like, we're not
is designed
sure.
to learn.
Yeah, science is turning into a bad word by too many people, unfortunately. So yes, there's going to be inconsistencies. Yes, it's not perfect. If we knew everything about the virus, we'd have, some kind of medicine or something. We'd be able to do something better with it. We're still learning. But that's the nature of it. You put your hand on a hot stove, you're not going to touch it again. You learn. So we learned this, and so I know I'm getting off on a tangent now because I'm angry. But
well, and this is the thing, talking about the confusion point, is we knew early May that masks were going to be really critical to any reopening being successful. And that was when we started to see communities like Travis County and Bexar County and Dallas County and Harris County try to establish these mask wearing orders. And we saw the governor take away their ability to do that.
Yes.
And, you know, we didn't, it became really unnecessarily partisan. I mean, it is, I mean, I represent a district that is about 52% Democrat and 48% Republican. I am very aware that about half the people who live here trust Governor Abbott or John Cornyn or anyone with an R next to their name more than they trust me. And so I was on calls with the governor where he was telling us, go tell people to wear masks and continue to social distance, or I'm going to have to shut the economy back down. And I'm like, could you tell them? Like, could we both tell them? Could we do this together? Yeah. Because they're going to believe us more if it's coming from both sides. And,
yeah,
you know,
and that's
very
unfortunate,
got,
but it's true.
And it got them stuck in a political corner where, you know, the governor didn't want to look like he gave in, but eventually had to, because we were teetering on the brink of a complete crisis with our hospitals. And, you know, folks got after me for using alarmist language around our hospitals. But if we had had another week of our hospital cases in Central Texas doubling, we would not have had the medical staff to take care of those people.
Yeah, because
that's when the mask order came in and started to slow things down.
Yeah, because a lot of people don't realize they were looking at the Hayes count early on going, our hospitals aren't that full. But that was because we were sending everybody to Austin. Most people, we didn't have a COVID unit in Hayes for so long. Seton Ascension.
Yeah,
you know,
and that
Ascension,
gets...
You know,
yeah.
So people saw that and they were like, that's not that bad. I was like, it is. Look at where Austin is. They're getting full.
Yeah, and I still don't have clarity on how Hayes County has been tracking hospitalizations. I've been pretty concerned about it because, you know, I have some data from Ascension that shows that a lot more Hayes County residents have been hospitalized than what the county has reported.
Well, who do I need to call? Who do I need to call to say, can you get us some numbers, please?
Well, and I mean, it's a little bit complex because I do want to say it's really hard to track the number of your residents who are in the hospital.
Yeah,
and
that
so
is true.
the right answer might not be stepping up and really trying to track those numbers down. That might not be the best use of time. The best use of time might be to just use the metropolitan statistical area data of who is in the hospitals, you know, because hospital systems, they operate in regions. They don't operate on county lines. So, you know, Ascension, Seton, last time I talked to them, or Ascension Hayes, they transferred the vast majority of their COVID cases to Austin. You know, they would only keep people that really needed to not be transferred. Honestly, generally laboring mothers, they wouldn't transfer and would keep in-house. And that's what works for them. It helped them to be more efficient, to have certain hospitals that are specializing in those cases. And there's nothing wrong with that. If the model works for the hospital system, it does. But that means we've really got to look at this data regionally. And what was concerning to me was this confusion I saw among Hayes County residents as the Hayes County hospitalization line stayed flat while the regional information was going whoop. And I'm going, there's no way we're a strange outlier. We're not. And the data I've been able to get since from some of our hospital systems really has confirmed that. So I just, you know, I want to encourage folks not to use the Hayes County hospitalization numbers as your measure of how bad things are. Use the regional numbers instead, because they provide a more complete picture.
Yeah, that makes sense. Okay, so here we go. What is working right now that you like, from planning, proactive testing? What is working right now, and what do you think needs to be fixed? Whether you're just a pipe dream, like what needs to change either in how the state is working, or what is the most alarming things that you say this needs to be adjusted immediately, or hey, let's continue doing this is fine?
The mask order is working. That, I'm trying to think if that's all I have or not. On working.
Well, I mean, like you said, though,
I do think our hospital, no, I actually would say, I think our hospitals are working, you know, and that's not a government issue. That's these private facilities. I think they have figured it out and are providing better treatment for people now than they were able to at the beginning of this crisis. You know, they've learned a lot, and they're doing a very good job managing capacity and finding ways to scale up. The biggest limiting factor for our hospitals in general at this time isn't beds. Folks talk a lot about bed availability. Well, a bed is worthless if you don't have a nurse assigned to the bed. The biggest limiting factor is the people to work them. And what was so scary about our hospital surge in July and late June was that Florida was having a surge, California was having a surge, Arizona was having a surge, Georgia was having a surge. We were having to compete with all of them to try and get extra medical professionals to help us.
Oh,
And so there just weren't enough people to go around. And, you know, we saw it be pretty bad down in the valley. I mean, Hidalgo County, Starr County got hit hard, and they had to send people away from the hospital. I mean, that, I feel like folks lost that in a lot of the mess of this, but we had hospitals in the state of Texas say, we don't think we can save you, just go die at home. And that happened down in the Rio Grande Valley. And it breaks my heart every time I think about it. And we were really close to nearing that point in the San Antonio area. The way we saw severity is it came up from the border in Laredo area. So they were the worst. Then San Antonio and Corpus Christi actually was quite bad as well. And then the Austin area was right behind them. So, I mean, there was a reason people were worried. There was a reason that after months of Governor Abbott resisting a mask wearing order, he issued one. I mean, the writing was on the wall that if we didn't change our behaviors quickly, that it would be bad. So that mask order is a very good thing. I hope it stays in place as long as possible. And then I'm really proud of the work our hospitals have done to make sure they're prepared to serve as many people as possible. And so those are the things I really think are working the best right now. A piece I think we're missing, and this got broken early on and has never gotten fixed, but is this sense of, you know, establishing really strong norms and safety practices for our businesses and other public accommodations. You know, we have some minimum health standard protocols that Department of State Health Services put out, but unfortunately, it's never been clear that those were required. They are technically required, but that wasn't ever communicated in those blunt of terms by anyone who had authority. You know, I'm a legislator. I'm not an executive agency person. I don't get to say this is the rule and I will come write you a ticket. That's something that has to come from the executive level. And on top of that, we had the way the whole, I hate saying her name, but Shelley Luther case up in Dallas played out, where, you know, a Dallas
barbershop?
Yeah, where a Dallas judge was enforcing the governor's order, and in fact, what the woman was sent to jail for was not violating the order. It was for contempt of court. And you know, the governor and the attorney general all went after the county and the city and went after the specific judge, and it really created this chilling effect all across the state on anybody trying to establish these really strong safety protocols for businesses.
Yeah,
And
Ted Cruz drove up and got a haircut from her to make a point of, we're not going to jail our people. But I was like, now I'm not cheering this woman getting jailed, but I'm like, we can't tell everybody, hey, enforce these, but we're not going to let you enforce them.
Yeah, I mean, and it just had this really chilling effect. And I think a lot of our local chambers of commerce have tried to fill in that gap. But, you know, I actually sent the governor a letter in late March, so a while back, saying we really needed like a safe business task force. And we've seen some of our businesses be incredible champions of safety protocols. HEB really stands out in terms of our bigger businesses. And I was like, how do we get everybody else to be like HEB? Like, that's what we want. We want everybody to be as conscientious as HEB. And, you know, I, as a consumer, if I'm going out, I want to know that the business I'm in is as safe as HEB. I mean, I saw folks playing this game of which business can I go to? Which one will people be wearing masks in? Which one will not be? And that had a chilling effect on the economy, and it had a long-term effect on our public health. You know, certainly here in Hays County, we saw a lot of our spread in the San Marcos area seem to be tied to bars and restaurants, and the folks who worked in them. Wimberley too had almost every single Wimberley restaurant shut down in a week because of COVID cases. You know, and so we've seen these venues be places where things can spread, but better safety protocols can improve it. So that's a piece I think is still missing. The contact tracing piece is missing, and I was started to go here earlier, but there's two steps to contact tracing. There's the case investigation, where a public health professional calls the person who has a positive case, gets some information that maybe they can use to draw patterns. You know, do they know where they were exposed or not? What do they know? Where have they been? And they'll also ask them for who their close contacts have been in the period of time they would be infectious. And then the second step is somebody, usually a different person because case investigation is a more highly skilled job, calls the people that were potentially exposed and informs them, hey, you were potentially exposed, please self-quarantine for this amount of time and get a COVID test if you can. Provided they're a test. The exact guidance around who should get a test has varied a lot from week to week, so I don't want to promise what people said. But that's the process. It's really simple. In Texas, it has been entirely voluntary for folks to talk to the public or to the case investigators and give that info. It's supposed to be confidential. The state of Texas has just never gotten the workers we need. And for Hays County, so a lot of counties are starting to use this system that Department of State Health Service has put together. It's called Texas Health Trace. Hays County, when I saw the data from it last week, had entered about 3,500 of their 4,900 cases into Texas Health Trace. Of the ones in there, fewer than 10% had the initial case investigation done. So I don't know about the 1,400 cases that weren't in there, and I'm not sure what the line is between those. I've asked the county for clarification, but I haven't received it. And there's always the outside chance that it's a user error and they're not checking the right boxes in the system when they're using it. But it really looks like Hays County has mostly not been able to do any contact tracing or case investigation, which is really concerning. And I'm going to take this and swerve it sideways and say that this really ties to our issues with opening schools. Because for us to from my perspective, for us to open schools successfully, we need a couple things. And we need testing that is available and accessible to anyone who needs it, who is attached to the schools. If a teacher or a child is exposed or a staff member, they've got to be able to access testing quickly.
With quick turnaround, not a week turnaround. Because then
And
that also runs into how does if a teacher is to get tested and then has to quarantine for 10 days, is that coming out of his or her sick pay? Who's paying for that? Their leave, how are they compensated and helped? Or is it voluntary? Because I've heard somewhere that it's voluntary, where during that couple days they can go back to work if they're not showing symptoms.
Well, let me address a myth really quick that you didn't say, but you alluded to. People have this idea that if they get a negative COVID test, they are in the clear. That's not how any of the testing works. The good testing, which most of the testing we talk about now is good, and we'll get into the differences in a minute. But the good testing has it has a negligible false negative rate. If you get a positive COVID test result, you are almost certainly positive. The exception would be like lab error or the sample was contaminated. The test doesn't make mistakes, but the person handling the material could potentially make a mistake. That hasn't been a major issue in Texas. There was one brief moment of it back in May, and those all got corrected. It was tied to one specific lab, and they fixed it. So if you get a positive result, you have COVID. If you get a negative result, particularly if you are asymptomatic or very mildly symptomatic or younger, there's a decent risk it's a false negative. For the molecular tests, the false negative rate is anywhere from 30% to 10%, which is significant. So DSHS's guidance is still, if you have any symptoms consistent with COVID, you should stay home and self-quarantine for 10 days, or, at least 10 days from when your symptoms began, or 3 days after your symptoms end, or your fever ends, I should say. So you need both 10 days since first day of symptoms and at least 3 days fever-free to be considered safe again. And their guidance for that is not based on a positive test result, though it would also apply to a positive test result. But it is if you have any symptoms consistent with COVID. So that's a fever, that's a dry cough, that's muscle aches, any type of flu-like symptom, or that dry cough, you're supposed to, or loss of smell or significant change in smell and taste is actually almost always a dead ringer for COVID. Any of those, you need to just self-isolate for at least 10 days. And that's really hard. And you're absolutely right, Josh, that schools have to set up new policies around this so that our educators aren't punished for doing the right thing. And so our students aren't punished and their families aren't punished for doing the right thing. And that's been really hard. And then if you have a close contact with somebody who's COVID positive, it's supposed to be 14 days. That's how you protect yourself, and that's how you protect your community. And that makes it tricky. So we definitely need those policies in place for every single school district. I wish I had an update on exactly where all the school districts were with that, but I'm not. I don't know if you know where Hayes CISD is with that, Josh, the leave policy side.
I don't. I know I'm impressed by what Hayes CISD has put out. I think their plan is better than a lot of areas around the country that I've seen. But talking to teachers that I know, the plan is still developing on how to handle it, on how the proper procedure is if I have symptoms or if someone has symptoms, how long they have to be. Because there were inconsistencies of people saying, oh, if you have symptoms but you haven't had the results back, it's your choice if you go back to school or not. I don't know if that's official policy or not, but that getting those inconsistencies. And that's the frustrating thing is there is still so much of how they're coming up with their plans on how to teach is a whole different story. I get how that is evolving and they don't have the plan perfect. I understand that. But you should have some kind of thing in place for how to handle a teacher or someone working in the school, bus driver, cafeteria worker that gets exposed, how to handle it. And do you shut down the whole school? Do you shut down the classroom?
So people need to be able to get the test. We need to get the results back quickly enough for them to be meaningful. And then on top of that, somebody has to deliver those results to the school. That's actually a really important component as well, that my understanding is folks are relying either on self-report or the health department. I have concerns about the health department's ability to do that in a prompt way because of what we just talked about. I don't know how they're going to match positives to schools or families of children or whatnot. Because if you're positive for COVID, you should not send your kid to school. Like they're a close contact, you need to keep them home until they're through the quarantine period and you're better. And then we need to have the policies in place like you spoke about to make sure that folks are separated in the ways they need to be to keep from having a dramatic case spike. And there's a lot of ongoing research about who spreads COVID how based on age groups. And it's a place where we're still learning a lot. We don't have very firm conclusions yet.
Because we shut the schools down and sent the kids home, so we don't have enough. You don't want to use them as a guinea pig and say, go to school so we can figure out how many get affected. But
there's some thought that younger kids do not expose COVID or do not spread COVID particularly well. I really hope that's true.
Me too.
But I do think we're in a place where the research is pretty preliminary because as you mentioned, Josh, folks have kept their young kids at home. I mean, I know my daughter has not seen, anyone outside my, I say extended family. I mean, she's seen my parents once, and my sister and her family once or twice. And that's, I mean, like she hasn't had any chance to spread anything. And that's how a lot of folks have handled their younger children recently. Cause kids aren't very good at social distancing. What is very clear is that teenagers absolutely can spread COVID. High school aged kids are perfectly good spreaders. They, again, tend not to get as sick, but we've had some pretty major spread events related to teenagers in Central Texas. Many of y'all may have heard about the big party in the Lakeway area where I can't remember if it was dozens or it might have even been over 100 different folks exposed. And then,
was it a
Blanco
COVID
County,
party? Was it
wasn't not intentionally.
Okay. I know some people have those.
And Blanco County had some spread events that were tied to high school students and recent graduates having parties together, where most of their suspected cases were tied to one party pretty quickly. So teenagers can definitely spread it. And that's something, teenagers and young adults, we don't get as sick. I say we. I'm 34. I'm not sure I'm quite the age demographic anymore that they're talking about. But folks who are younger tend to get less sick. Not exclusively. Some young people have died, but teenagers in general tend to get less sick, and people in their 20s. But that doesn't mean they're not contagious. Some of the super spreaders we've seen have been people who are part of that demographic and for whatever reason just expel a whole bunch of virus in a short period of time. And because we don't get as sick, we're more likely to go out and about and interact with others.
And we have to be concerned for the adults that are at the school with them, the extra, every single staff member, whether teacher or not, that's the bus drivers and the sanitation and custodial and cafeteria workers.
And we're seeing cases among the adults at most of our school districts right now without having anybody there. Well, without having students there, I should say. And I think that's a really important norm for our schools to establish. And I know this is stuff they're all talking about, but when the teachers go into the break room, they still have to social distance. Mm-hmm. They still have to wear their masks because they, to each other, at least with the elementary school age, might be the biggest risk. Again, we're still putting that information together. Don't trust anyone who makes giant pronouncements that XYZ demographic can't get or can't spread COVID. Everybody can, but some people are less likely, we hope. Yeah. And there was some reporting about a camp here in Texas where almost every single person who attended the camp got COVID. And it was a camp. There were not a bunch of adults coming out. The counselors were young adults, but almost all of the younger students had it as well.
Yeah, there's been a couple cases of that. The one in Branson, Missouri. There was one in, I think, Florida, where there was a camp, an overnight sleepover camp, where there was a tremendous outbreak where they had to close it down because of that. So it can happen, like you said, but hopefully they don't suffer as bad. They don't. Yeah. It doesn't. There's just so many unknowns that's what makes me nervous about people just going, we're fine, open up, we just got to live with it. We just got to yes, we have to live with it, but that doesn't mean that we should ignore it or stubbornly go about our life and just think,
Well, and here's the thing is, folks, I hear a lot of pushback about mask wearing or any other precaution. We'll say, well, gosh, hasn't there been enough suffering? Can't we just open businesses? Can't we just open schools? Can't we just get stuff back to normal? Our ability to be successful at that is so dependent on folks making the individual behavioral modifications. Now, it's a lot harder to teach kids to do those. That's real. But those of us who are adults, we do not have an excuse. So take the steps, do the mitigation, and it gives our businesses a chance at staying open and having customers, because being allowed to be open doesn't really matter if nobody wants to go to your business because they're worried about getting sick. It gives our schools a chance at being successful, because if our kids return to the classroom and we see massive outbreaks the first couple weeks, they're going to close back down and go all virtual. That's real. I mean, we are not going to accept dozens of ill children. No. In this state. I mean, I really don't. I mean, I've been surprised at some of the things we have accepted and have tried to normalize, but we're not going to accept sick kids, and we will end up with sick kids if we don't take all the precautions we need. And I want to say those precautions go well beyond the schoolhouse door. Those are precautions we have to take as a community, because the lower we get our case counts, and I say our case counts, we talked earlier about how our testing has dropped, so it's harder to trust our case counts. But we have got to take steps to reduce the prevalence of COVID in the community so that everyone else can be successful. And wearing a mask is the single biggest thing you can do in your day-to-day life. And
it's such a simple message is that, yes, you can, go ahead.
Well, I was going to say the other factor, and I heard from the Blanco County Health Department about this, but I haven't heard from the Hayes. One thing that's shifted with our testing and is potentially impacting our numbers is the onset of antigen testing. So early on, we had two types of testing. We had molecular or PCR, and we had serological or antibody. Now we also have antigen, which is a kind of serological, but a little bit different. So molecular is they're looking for strands of RNA of the virus's RNA. That's what they're looking for. Like I said, a positive is a positive, unless there was major lab error or contamination of the sample, but a positive is a positive. Antibody tests started to come out. The antibody tests have been problematic in several different ways. The false positive, or their false positives are a thing because coronavirus is related to some viruses that cause the common cold, and there were issues with cross-reactivity. And what an antibody test is looking for is evidence that your body has responded to the virus. And then those also had a pretty significant false negative rate as well. So antibody tests, they came out, folks tried them, they played with them. generally the conclusion of the public health folks has been is that they're not useful and the results aren't super useful from a public health perspective at this point. Potentially useful, sort of in the rear view mirror to kind of see prevalence numbers, but not useful for diagnosing cases while they're ongoing. The new type of testing we have and that we're starting to get more of is what's called antigen testing. It's also looking for evidence that your body has reacted to COVID-19, but they are very fast and they are much more accurate. So positives in antigen testing, they're positive. Now, they're not as sensitive as a PCR test. Their false negative rate is pretty high. But what they're really useful for is screening people out quickly. So you never trust a negative antigen test, but you can trust a positive one. What has happened in the state of Texas, and this is due to CDC guidance, antigen positives are considered probable cases. Texas does not count their probable cases with their confirmed cases. So what we don't really know right now in the state of Texas is how many antigen tests are happening where people aren't following up with PCR tests, so they never become confirmed cases.
Oh, wow.
I know that in Blanco County, they've pretty much been able to follow up with PCR tests for all their positives. Quite frankly, it's a waste of a test to use a PCR test for these folks, but it's what they're having to do to get them confirmed. This is CDC guidance the state of Texas is following. But it's something that is potentially masking our numbers in a new way.
Great.
So it's another concern. But they're useful numbers. And I do feel like there was one other data thing I wanted to talk about, Josh. I know I'm talking too much, but.
No, this is all about you. I don't want to talk.
The other thing I wanted to say about data is we changed how we're tracking deaths in the state of Texas, and this just happened a few weeks ago. We used to track deaths at the state level based on what was reported up from the county. And the county, got that in various ways. They switched, the Texas Department of State Health Services switched to tracking it based on death certificate instead. And they are attaching the date of the death to the date on the death certificate instead of the date it was reported. So this means a couple things. First of all, it's an overall better number long term, and they're looking, and it is specific to deaths where COVID was considered a major contributor. So a lot of folks have had questions of like, oh, are our numbers inflated? If you get in a car accident and you have COVID, is that a COVID death? This eliminates the risk of that. So it's only deaths where COVID is considered a major factor in the death. And quite frankly, that ends up missing some folks for a couple of reasons. One is that some people have been marked recovered from COVID, but have been so weakened that they passed away shortly after from technically another cause, but COVID was the cause. And the other factor is that we know that COVID can cause major cardiac events. So strokes, heart attacks, and a lot of folks who die at home don't get tested after passing away because tests have been scarce. So the numbers are low, I guess is what I want to say. Our death numbers are still lower than the real number, and there's sort of no way to ever get them perfect. What we can kind of look at is the number of extra deaths we've had.
Which the New York Times has done a study on that recently. The excess deaths in America is extraordinarily high out of proportion for other years.
No, we have lost more people to COVID than we know. And we'll ever know, which makes, there's a way of thinking about the fact that we will never know that makes me quite sad. But tracking on the death certificates, I think, is an improvement. When they did that initial switch, they found 600 deaths they didn't previously have that just somehow hadn't made it to the county health departments. And now the big caveat with that is it means if you're looking at Department of State Health Services graph of deaths, you have to only look past 2 weeks back or further, because those death certificates can take up to 10 days to come in. And so waiting for those. Now, whether or not that causes a lag in different regions really depends. I've certainly observed a pretty long lag in Hays County with deaths being reported. But some of the bigger counties with, giant health departments may have been able to turn stuff around faster. It really varies. But what it means is that they're going to have days. So like yesterday was the 15th. As of yesterday, we don't know how many people died that day. We got to wait for the death certificates. So the numbers for that day don't mean anything yet. The point where they become meaningful is 2 days back. So I would look August 2nd and before to watch the trends. So it can create this sort of false downward trend that's not real because we're just waiting for the numbers.
Yeah, I saw someone had shared a new data stream where it showed like the peak that was in Hays County was actually like a week after we thought was our peak because of the new data coming in.
Yeah, and that was I'm so grateful the Texas Department of Emergency Management keeps bringing testing to Hays County, and my understanding is they're working to come back. Though we really need our own local testing setup. There's been a lag in some of the TDIM data reaching the health departments. And so they had, I'm going to not remember the exact number, but hundreds of cases, positives come back, over a month later that they then had to go put back into the system. And it definitely changed that graph, as you mentioned.
Yeah. Well, Hays had that big 500 count of cases jump that
like
terrified me Yeah, it terrified me because all of a sudden the little spike was like way up high, and I was like, "What just happened?" And then it disappeared quickly, and they were like, "No,
that was mostly from the testing days in late June and early July."
Yeah, the mobile testing sites, correct?
Yeah, there were also a couple that went all the way back to March that hadn't made it to the county.
So,
you wanted to know what's going well?
Yes, it's going. Look, I think the big takeaway for me from this conversation that we've had is one, testing and contact tracing. That's a tough one to say. Has to be better. It has to be better in the efficiency of the test, the time and response of the test, and the availability of the test. It has to continue to get better. The contact tracing has to start, basically, which it hasn't. But at the end of the day, it really just comes down to community awareness and helping everyone you can. You wear the mask into the grocery store because then you might get someone sick there that might not want to work because they're afraid of getting sick, but they need a job so they can pay bills and take care of their family. So if we just take care of each other, Buda did a great job with the Chamber of Commerce with the Taste of Buda. They put up a system for people to support businesses, local businesses, twice a week, eat out, and they would give prizes for people that share they ate out. Taking care of each other helps, and we need more of that. So we need to stop fighting those masks and fix some of the communication issues that are going on.
We do. And I will get on my soapbox here for a hot second and say that, I would not eat in an indoor restaurant right now. Like, I personally do not think it's a good idea. But takeout is totally safe. Like, get all the takeout you want. There's no evidence of COVID-19 being transmitted through food. Honestly, the evidence more and more comes back that it doesn't transmit very well through surfaces. So, it's very unlikely that COVID will sit on the plastic bag that your food comes in. Takeout is safe. Takeout is safe. And I know I've had some, I'll say Buda or say a Buda business. I've had some great takeout from Brooklyn's recently. You wouldn't think that a crab stuffed avocado would make it home that well, but it does.
But I don't have any more questions for you, Erin. We have been talking forever, and I really appreciate it. I've learned a lot, actually. There were a lot of things I didn't realize, and you explained things much better, especially with the testing, the antigen testing and all of that. Thank you. Thank you for coming out here and talking with me.
I actually have to correct myself on something because I said something wrong about the testing.
So, go for it.
And it's just background stuff. It's not, but I said that antigens were looking for evidence that your body responded to something. That's not true. Antigens are like little particles created by the virus. So antibodies respond to antigens. So that's part of why antigens are great. In fact, if you go to the doctor and you get a flu test, you're generally getting an antigen test.
Okay. Well, no, that's fine.
Anyway,
I never would have known that, but there are medical people out there going, "What? That's wrong."
I mean, my dad would judge me hard if he heard me say that. So.
Well, you corrected yourself. It's okay. You got it. So, so thank you. Thank you for coming out here. Thank you for everything that you've done so far before COVID-19, and good luck with the elections coming up. I'm glad we didn't talk about that because that's a whole other story. But
I'll get on my soapbox very quickly about COVID and elections and say
Do
that
it.
whoever you are, if you care about COVID and controlling the spread, do not go knock on people's doors right now. Bad practice.
Yes, yes. And Buda had to shut down solicitor license because people were still doing it. They were still coming door to door knocking without masks. I had people coming to try to sell me alarm systems without masks. I'm like, you know what's going on, right? And don't send your employees out. I know it's not always the employees, but don't send your employees out to go door to door. Oh my goodness.
No, it's a bad move right now.
So
better ways to do things. And certainly trying to prevail in an election is not worth getting people sick.
Yep.
And candidates and campaign workers are we're designed to be massive spreaders. We just meet too many people.
Get your signs out, get your bumper stickers. That there you can help that way, but don't come knocking on my door. But thank you very much. This was great. So, and we'll share this out and let everybody see it so they can learn some stuff too. So thank you all.
Thanks so much for doing this, Josh.
Yeah, absolutely. And thanks everybody for watching. We'll hopefully get some more of these.
Yeah.
So thank you.
All right. Have a good one, y'all.